Welcome, ladies and gentlemen, to the Minority Health and MillionHearts, a Path Forward webinar. Your host for today is Ashley Lee. You may begin.
Thank you. Welcome to the Disparities in Cardiac Health program. This is our May webinar featuring Dr. Erica Taylor. I'm going to go over a few announcements before I introduce our keynote speaker. The change package will be distributed in May. Our Governor's Award of Excellence overview and guidelines have been distributed. If you have any questions, please contact Melissa Ottinger. Our data submission was due on April 15th. If you have not submitted your data, please do so as soon as possible. If you have any questions or technical assistance, please contact us by email at DACH@mpro.org. If you would like to be placed on our volunteer email list, contact one of the DASH team members or email us at dash@mpro.org. We have a few upcoming events. May is National Stroke Awareness Month. The aim is to increase the public awareness of the signs of a stroke and life-saving actions one can take to act fast. DASH will be holding a blood pressure screening on May 19th at 11 a.m. to 1 p.m. at Assumption Grotto Catholic Church in Detroit. Also, watch your mailboxes for the June DASH webinar and mark your calendars on June 19th for Johnny Wong, President and Founder of Street Medicine. We will be holding a webinar. On June 15th, we will be holding another blood pressure screening at Perfecting Church in Detroit. For more information, please contact us at dash@mpro.org or visit our website at mpro.org. Our speaker today is Dr. Erica Taylor. She is currently a data analyst at CMS Innovation Center, where her primary responsibilities are serving as an expert on program evaluation and serving as minority health lead for MillionHearts, which is dedicated to preventing 1 million heart attacks and strokes by 2017. Dr. Taylor's experience at CMS includes working in the areas of Medicare reimbursement and survey and certification, specifically ensuring the delivery of quality health care to nursing home residents. Dr. Taylor has worked with CMS for 8 years. Dr. Taylor?
Thank you so much, and thanks for the invitation to speak today. I'm delighted to have an opportunity to talk to you all about MillionHearts and minority health. And I talk about this in terms of a path forward because it means that we have not yet arrived, but we're certainly on our way there given the context of what's going on in the government and with HHS. So with that, I will begin. And so MillionHearts, as you probably are already familiar with, is a national initiative co-led by the Centers for Disease Control and Prevention and the Centers for Medicare and Medicaid Services. And we have partners across federal and state agencies as well as private organizations. Our goal is to prevent 1 million heart attacks and strokes by 2017. Now, on the next slide, I'm going to talk about the context in which we operate. This is the slide that shows talks about the National Prevention Strategy. The National Prevention Strategy aligns and focuses prevention and health promotion efforts with existing evidence-based programs. The council that created it provides ongoing leadership at the federal level on how agencies across the government can coordinate efforts to improve the nation's health by incorporating health considerations into decision-making processes and enhancing collaboration in health promotion initiatives. The aim of the National Prevention Strategy is to guide, and I quote, guide our nation in the most effective and achievable means for improving health and well-being. The strategy prioritizes prevention by integrating recommendations and actions across multiple settings to improve health and save lives. The strategy envisions a prevention-oriented society where all sectors recognize the value of health for individuals, families, and society and work together to achieve better health for all Americans, end quote. So the graphic you are viewing now shows the four strategic directions of the strategies. Is the health and safe communities environment. Health and safe community environments is the first one, up on the top left. And then we have the clinical and community preventative services on the right, empowered people, and the elimination of health disparities on the bottom right. The last thing I will emphasize here about this particular graphic is how each of these strategic directions are connected to the other, meaning that focusing on one has an influence on the others, but also that each directional aspect needs to be addressed in order for us to complete the circle in getting to goal. So here we have, if we focus in more on the bottom right of the former graphic, or that was just up on the slides, into the elimination of health disparities, which is the focus of this particular talk, there are a couple of things that are important to talk about. First, we want to ensure strategic focus on communities at greater risk, reduce disparities in access to quality health care, increase the capacity of the prevention workforce to identify and stress disparities, and the correction of disparities, support research to identify effective strategies to eliminate health disparities, and standardize and collect data to better identify and address disparities. Now, in addition to the National Prevention Strategy, we have the 2011 National Stakeholder Strategy for Achieving Health Equity. And this is a product of the National Partnership for Action. So all these plans look across federal departments, and the strategies just mentioned are complemented by the HHS Disparities Action Plan, which builds on national health disparities goals and objectives unveiled in Healthy People 2020, which some of you are probably familiar with, and leverages key provisions of the Affordable Care Act and other cutting-edge HHS initiatives. So first, I think I need to tell you about the Disparities Action Plan and its goals. They are the goals of the Secretary and her priorities, which are to transform healthcare, strengthen the nation's health and human services infrastructure and workforce. You'll see some of this language reminiscent of what we talked about with the National Prevention Strategy as well. Advance the health, safety, and well-being of the American people. Advance scientific knowledge and innovation. And increase the efficiency, transparency, and accountability of HHS programs. Now, they have specific, in the Disparities Action Plan for HHS, there are specific actions that aim to reduce disparities in health insurance coverage, access to primary care services, care coordination, things like that. They also look at about increasing the ability, again, reminiscent of the National Prevention Strategy, of healthcare providers and health systems to address racial and ethnic disparities, and collaborate with individuals and health professional communities to make enhancements to national standards of culturally and linguistically appropriate services in healthcare. One of the key points that are really cool about this, and this is my personal opinion, that it also looks at promoting the use of community health workers and increasing the diversity of the healthcare and public health workforces. One of the goals of MillionHearts is to make sure we're focusing on team-based care, so we're touching providers across all of the health or the allied health professions. And also, another one dear to my heart and to this presentation is to reduce disparities in population health by increasing the availability and effectiveness of community-based programs and policies, particularly around the areas of obesity, asthma, flu, vaccinations, tobacco use, and prenatal childhood and maternal health, but also cardiovascular diseases in there too, and that's where MillionHearts fits. I'm just going to advance to the next slide and tell you why we are coming together around this particular disease, cardiovascular disease. There are compelling reasons. The evidence is very compelling, and as to why we should begin with heart attacks and strokes. So while we've seen a gradual decline in mortality from cardiovascular disease over the last 40 years, it remains the nation's leading cause of death for men and women of all races and ethnicities. And if you look at the slide here, you'll see, and these are 2010 stats for the second bullet, but 800,000 deaths were due to heart disease and stroke. Equally compelling is the fact that there were $444 billion in healthcare costs and lost productivity attributed to those deaths in 2010. But also, heart disease and strokes are the greatest contributors to racial disparities in life expectancy. And it's the leading cause of preventable death in people under the age of 65. Here we have the ABCs, and I just want to quickly go over these quickly with you. Cardiovascular disease, we know, is everywhere. It's traumatic for people and for their loved ones, and it clearly shown by the previous slide, it's expensive. So here's another compelling reason that the federal government and private sector partners are focusing on cardiovascular disease. Despite the widespread availability of evidence-based treatments that prevent heart attacks and strokes, we are failing as a nation to deliver them to even half of those in need. Most surprisingly, let's look down at the smoking one. This is particularly troubling because the denominator here are those smokers who have already decided to stop smoking, and only 23% of them are receiving the behavioral counseling and pharmacotherapy shown to help people quit. So clearly, a focus on the ABCs, improving the ABCs, is going to give us the quickest impact, and as you can see, there's certainly room for improvement. Let's talk a little bit about the key components of Million Hearts. There's a collection of interventions that have been proven more successful than any other single intervention, and for Million Hearts, we have the clinical interventions, which you see on the left-hand side of the slide. First, to draw attention to healthcare professionals and the systems in which they work to the ABCs. So we want to prioritize the ABCs. Second, we want to get health information technology to work more efficiently for busy practitioners and the patients they care for. And thirdly, we want to develop and test new models of care that recognize and rewards outcomes and value. If we look onto the right side, we have the community part, or the community interventions or environmental interventions that look at smoke-free environments, creating smoke-free environments, zero trans fats in the food supply, lower sodium in our food supply. But here, it's the theory that we have for Million Hearts. We at Million Hearts believe that the key to bridging the gap between clinical and community interventions is to focus on minority health. But bridges, while formidable, are not static, and they require attention and maintenance to ensure continued effectiveness. I like to think about this attention and the focus as like minding the gap. I think that phrase started somewhere over in London about the gap between the platform and how you get onto the train. So I like that term. So we are actually minding the gap. We know that failure to mind this gap by focusing on minority health does not simply maintain the status quo, but rather exacerbates disparities in health for racial and ethnic minorities. The Million Hearts Minority Health Team, therefore, was created in November to ensure a sustained focus on issues relating to minority health and cardiovascular disease. So here is our charge. Million Hearts has developed a plan to address health disparities in minority populations, and that the Million Hearts Minority Health Team has been charged with executing that plan. And 2013's plan includes a faith-based organization project that we'll go into detail about later on, a little bit later on, one of them, and a dissemination of community health worker module for hypertension, community-based organizational outreach, and establishing linkages to minority health provider organizations and engaging them in the Million Hearts work. And where possible, we like to link Million Hearts with other federal initiatives focusing on health and well-being of minority populations.
Dr. Taylor?
Yes, please.
Can I intervene for a moment?
Yes, please.
I would just like to let our attendees know that during this call there will be a live chat with the DASH team member, Capri King, and to feel free to ask any questions during the call.
Thank you very much.
Thank you, Dr. Taylor.
So here, let's look at the economics or the economic consequences of health disparities. This slide should shock us all, not shock us, but just call us to attention in a very concerned way about how there is so much to be done and how we have so far to go. We're starting in Million Hearts by looking at hypertension. And so the B in the ABCs is hypertension or blood pressure control. The Vital Signs report found that nearly one-third, or about 67 million adults in the U.S. have hypertension, and 36 million adults, or about slightly more than half, 54%, are not controlled. On a macro scale, the usual culprits are lack of health insurance, a usual care provider, or receiving health care in the past year are not necessarily a problem because 32 million of the 36 million adults with uncontrolled hypertension have a usual source of care. 30 million of the 36 million have health insurance, and 26 million have seen a health care provider in the last, or at least twice in the last year. In fact, 14.1, MillionHearts is co-led by CMS. 14.1 actually million have Medicare. But let's mind the gap and look a little closer. The Institute of Medicine's IOM Landmark 2002 report on equal treatment confronting racial and ethnic disparities in healthcare identifies the lack of insurance as a significant driver for healthcare disparities. Lack of insurance, more than any other demographic or economic barrier, negatively affects the quality of healthcare received by minority populations. So this is where we're reminding the gap. Racial and ethnic minorities are significantly less likely than the rest of the population to have health insurance. They constitute about 1/3 of the U.S. population, but make up more than half of the 50 million people who are uninsured. Members of racial and ethnic minority groups are also overrepresented among the 56 million people in America who have inadequate access to primary care physician. And minority children are less likely than non-Hispanic white children to have a usual source of care. So these statistics are staggering, and it shows, again, more evidence that we have a lot of work to do. So let me tell you a little bit about our blood pressure control plan. As I mentioned, we're starting with hypertension. We know that hypertension control can take us far in preventing heart attacks and strokes and mitigating other comorbid conditions. So here's our blood pressure control plan in 5 simple steps. We want to identify the undiagnosed, move the treated to controlled, coach in self-management, drive measurement and reporting, educate and activate about high sodium intake. Now I'm going to share with you more detail about a program that seeks to address 3 of these goals, which is we're identifying the undiagnosed, moving the treated to control, and coaching in self-management. 100 Congregations for MillionHearts is the program that I want to talk to you about. And the purpose of 100 Congregations for MillionHearts is to enlist the support of faith-based organizations in increasing awareness and action around cardiovascular disease prevention by focusing on hypertension control. 100 Congregations for MillionHearts is launched in Baltimore, Chicago tomorrow. Actually, it's being launched in Chicago tomorrow. Philadelphia happens on April 23rd, and San Diego and Tulsa are 2 remaining cities that will be launched in before the end of June. So it's a faith-based project across faith designed to bring attention to hypertension control by enhancing awareness and attention to high blood pressure, linking communities and clinical settings for better blood pressure control, increasing self-monitoring by individuals with hypertension, and providing sustainable programming about heart health. But this is also important. Growing a MillionHearts network of faith-based organizations is important that if we're touting the importance of community involvement in the prevention practices, it's important to make sure that we have a network where we can be advised by community participants and leaders on how we should go forward in making sure that we're creating a better or a higher quality of life for all Americans. So, I've said a lot today, and the obvious question is, what is a healthcare professional to do? Well, it's important to understand concrete ways in which we can play a bigger part in cardiovascular disease prevention. So first, by prioritizing excellence in the ABCs and starting with hypertension. As I said, hypertension control goes a long way in helping us not with just cardiovascular disease, but other comorbid conditions that relate to hypertension or that hypertension plays a part in. We know that med adherence, of course, with that helps to reduce across the board for any reason, helps to reduce the number of admissions to hospitals and hospital stays. But also, we want to measure the way to better outcomes. So chart your own progress towards control among individuals within your sphere of influence, whether it be at the provider level, at the individual docs level, at the hospital level. There's a way that we can chart how to move forward by charting where we are, understanding certainly where we are with specific attention on which of our populations are most at risk here. Then let's go on and say we want to emphasize adherence. I'm going to start here. Let's go back to getting personal when it comes to risk. By getting personal with the risk, we allow individuals to fully comprehend the impact heart attacks and strokes can play in their lives. So attention to heart health means that they get to spend more time with loved ones, celebrate more birthdays, graduations, quinceañeras, or simply enjoy the everyday experience of being around the people that mean the most to them. And so if we can somehow link it into the importance to how it impacts daily life, then certainly that would be a help in moving us forward. We want to emphasize the importance of adherence as a path to heart health, create environments where individuals are reminded or even bombarded with heart health messaging. You'll see here it says deploy team members to teach and reinforce badger individuals to know the importance of making sure that their hypertension is under control. And lastly, if we can share successes and challenges, the successes and challenges that you have with us so that many others can benefit from your expertise. What we're doing now is trying to collect success stories from around the country and highlight them in the form of webinars and other venues on the website to let people know that these are the contexts in which successful interventions have worked, and this is how you can do it there. And these are the infrastructures you need to help those happen within your area of practice. The National Prevention Strategy, the National Stakeholder Strategy for Achieving Health Equity, and the HHS Disparities Action Plan combined have provided a framework for us moving along the path forward. Providers across the allied health professions play a pivotal role in reducing the burden of disease for all Americans. And here are a couple of actions that you can take to help fight the health disparities battle. First, we can use the data you collect to its full extent by identifying populations greatest at risk and work with communities to implement policies that address priority needs. Working with community leaders and members to enhance health. Sometimes we fail to recognize or acknowledge the deep wellspring of resources and knowledge indigenous to the communities that we're working with. So let's strengthen our resolve to work with them in planning, in the planning, implementation, evaluation, and maintenance stages of our cardiovascular disease efforts. And as part of the Plan, Do, Study, Act cycle that you hear a lot about in quality improvement, it's important that we improve state collection for underserved populations to improve programs and policies. It's important that this data is collected so that we can learn and move forward and teach others. So in conclusion, I'll just tell you that all of the strategies that I've talked about before and some of the sources I have listed here on this resource page. Please feel free to go ahead and click on these and learn more. I did give a brief overview of them. Certainly there's more depth and knowledge to be gained by reading them yourselves. But in conclusion, the path forward for a healthier nation is intimately tied to the quality of care and attention we pay to vulnerable populations. By focusing on cardiovascular disease prevention and minority health, we journey forward along this path that strengthens the abilities for individuals, for families, for neighborhoods, for communities, for cities, for states, and so on. Our nation strengthens all of these things for our nation to enjoy a higher quality of life, no longer plagued by the burden of disease. We can become the people we're meant to be. Thank you.
Operator, I'd like to open the line for questions.
At this time, ladies and gentlemen, if you have a question, please press the number 1 key on your telephone. Again, please press the number 1 key on your telephone. Okay, there are no questions at this time.
Okay. I would like to bring up the survey for our attendees.
Ashley, may I just add one thing, please?
Absolutely, Dr. Taylor.
If there are further questions or if you have questions about Million Hearts or what we're doing with the Minority Health Team, please feel free to send those inquiries to MillionHearts at cms.hhs.gov. Again, that email address is MillionHearts at cms.hhs.gov. And you'll see on the slide just now that we have the website address for Million Hearts as well. Thank you.
And thank you very much, Dr. Taylor.